Alright, let's get into one of the most important topics for this year's Medicare season, comparing the top Medicare Advantage plans for 2026. Whether you're enrolling for the first time or thinking about switching your plan, this breakdown is going to help you understand which options stand out, what changes to look for, and how to make the smartest decision for your healthcare coverage and your wallet. Now, 2026 is shaping up to be one of the biggest years for Medicare changes we've seen in a while. Between new premium structures, expanded drug coverage, and updates to plan benefits, it's getting a little complicated to figure out what's best for you. So today, I'll walk you through how these plans compare, what's new for 2026, and how you can decide which Medicare Advantage plan gives you the most value for your money. First, let's start with what's driving all these changes. Healthcare costs have continued to rise nationwide, and as a result, we're seeing adjustments in Medicare Advantage premiums and benefits to reflect that. But 2026 isn't just about costs going up, there's actually some good news here too. The new Medicare rules will bring more transparency, more flexibility for enrollees, and stronger limits on out-of-pocket drug costs, thanks to the Inflation Reduction Act. Now, before we dive into specific plans, remember, Medicare Advantage, also known as Part C, is a type of plan offered by private insurance companies that contract with Medicare. These plans bundle your Part A, hospital coverage, Part B, medical coverage, and usually Part D, prescription drug coverage, all into one. Many also include extras like dental, vision, hearing, and wellness benefits. The idea is convenience and cost efficiency, one card, one plan, one company handling it all. Alright, let's talk about some of the top contenders for 2026 and how they compare. We'll go over 5 of the strongest nationwide providers based on coverage quality, customer satisfaction, costs, and new benefits rolling out in 2026. Starting with United Healthcare, which continues to hold the largest share of Medicare Advantage enrollees in the U.S. For 2026, they're maintaining strong PPO and HMO options, with most plans including dental, vision, and hearing benefits, along with gym memberships through Renew Active. Their premiums are still very competitive, and their network remains one of the largest, which is a huge plus if you travel or spend time in multiple states. The new updates for 2026 include expanded telehealth benefits, $0 copays for select chronic condition medications, and better pricing transparency for members. United Healthcare also continues to partner with AARP, so if you're an AARP member, you might see added perks or personalized plan recommendations. Next up, Humana, which remains one of the most trusted names in Medicare Advantage. For 2026, Humana has focused heavily on keeping costs stable while expanding benefits. One of the most appealing updates this year is their Healthy Options Allowance, which gives members a monthly spending allowance that can be used on groceries, utilities, and over-the-counter health products. Humana's premium-free plans are still available in many areas, and they've expanded coverage to more rural regions. If you're someone who values customer service and preventive care, Humana is a solid choice. Their star ratings continue to be strong, and their emphasis on whole-person health, physical, emotional, and social well-being, makes them stand out. Now, let's look at Aetna, which has been steadily growing in popularity thanks to its simple, affordable plans and CVS Health connection. Since CVS owns Aetna, members benefit from integrated pharmacy services, convenient in-store health clinics, and more affordable drug options. In 2026, Aetna is focusing on lower out-of-pocket maximums and increasing the number of $0 premium plans. They're also adding coverage for transportation to medical appointments and offering meal delivery after hospital stays. For people with chronic conditions or those recovering from surgery, these perks can make a big difference. Moving on to Kaiser Permanente, which is a bit unique because it operates as both the insurance provider and healthcare network. That means all your care, doctors, hospitals, specialists, pharmacies, is within one coordinated system. For 2026, Kaiser has continued to invest in digital care options, like 24/7 virtual visits and integrated care management. Their preventive care programs are among the best in the country, and their satisfaction scores remain very high. The only drawback is availability. Kaiser plans are limited to certain states and regions. But if you live in one of those areas, you'll likely find the quality of care to be excellent and the out-of-pocket costs very predictable. Then we have Blue Cross Blue Shield, a collection of regional providers under one umbrella, which means plan details vary by state but share a strong reputation nationwide. In 2026, BCBS plans are emphasizing flexible PPO options that let you see out-of-network providers at reasonable costs, perfect for people who want more freedom in choosing doctors. They're also increasing supplemental benefits like hearing aids, dental care, and fitness programs. BCBS plans often appeal to those who prioritize balance, broad provider access with solid value. So, when you're comparing these top plans, United Healthcare, Humana, Aetna, Kaiser Permanente, and Blue Cross Blue Shield, it really comes down to what matters most to you. If you travel a lot or live in multiple states, a large network like United Healthcare or BCBS is ideal. If you want all your care under one roof, Kaiser might be the best fit. If affordability and pharmacy access are your priorities, Aetna is hard to beat. And if you're looking for extra benefits like grocery and utility allowances, Humana might be your best match. Now, let's talk about what's new in 2026 that affects all Medicare Advantage plans. First, drug cost reductions. One of the biggest changes is the $2,000 annual out-of-pocket cap on Part D prescription drugs, starting in 2025 but fully implemented and standardized by 2026. That means no matter what Medicare Advantage plan you're on, your total prescription drug expenses will be capped, and that's a huge relief for seniors who take multiple medications. You'll also see more generic drug substitutions and negotiated price reductions on high-cost medications. Second, expanded supplemental benefits. Many plans are competing harder by adding benefits that go beyond traditional healthcare. We're talking about home-delivered meals, fitness incentives, transportation, and even personal emergency response devices. In 2026, insurers are focusing on whole-person wellness, not just treating illness, but preventing it. Third, technology integration. Expect to see more telehealth options, virtual visits, and remote monitoring for chronic conditions. Some plans will even include devices like blood pressure monitors or glucose meters that sync automatically with your doctor's office. Fourth, premium and deductible changes. On average, Medicare Advantage premiums for 2026 are expected to remain relatively stable, with only slight increases in certain markets. However, deductibles for Part B services may rise slightly, reflecting overall healthcare inflation. Now, let's be honest, Medicare Advantage plans aren't perfect. While they often save you money up front with low or $0 premiums, they can have network restrictions, prior authorization requirements, or varying coverage limits. That's why comparing these top plans side by side is crucial before you enroll. Don't just look at the premium, look at the maximum out-of-pocket cost, drug coverage tiers, and provider network size. And remember, the annual enrollment period, October 15th to December 7th, is when you can make changes. This is the time to review your plan's annual Notice of Change, ANOC, and compare it with the new options for 2026. Plans change every year, doctors move in and out of networks, premiums shift, and benefits get updated. When choosing, here's a tip: focus on total value, not just premium cost. A plan with a $0 premium might sound great, but if the copays are higher or your medications aren't fully covered, you might end up paying more over time. Use Medicare's Plan Finder tool or talk to a licensed Medicare advisor to compare based on your personal healthcare needs and medication list. Another big consideration for 2026 is star ratings. Medicare assigns star ratings, from 1 to 5, to every Medicare Advantage plan based on quality of care, member satisfaction, and customer service. Plans with 4 or more stars usually provide better experiences and may receive bonus funding from Medicare, which they can use to enhance benefits. In 2026, many of the top plans we mentioned, United Healthcare, Humana, and Kaiser, are projected to maintain strong 4+ star ratings. And if you're wondering about the future, Medicare Advantage enrollment is expected to grow even more in 2026, possibly exceeding 33 million people nationwide. Why? Because people love the simplicity of having all their coverage in one plan, often at a lower cost than original Medicare with a supplement. So, what's the bottom line? The best Medicare Advantage plan for you in 2026 depends on your personal situation, your medications, preferred doctors, travel habits, and financial goals. There's no one-size-fits-all answer, but comparing the top plans we discussed will help you narrow down the best fit. If you want wide access and flexibility, United Healthcare or BCBS might be your top choices. If you want cost stability and strong preventive care, Humana or Aetna could be the way to go. And if you're lucky enough to live in an area where Kaiser Permanente operates, it's hard to beat their coordinated care model. Whichever plan you choose, take time to review your options carefully before open enrollment ends. A few hours of research can save you hundreds or even thousands of dollars over the next year, not to mention giving you peace of mind that your healthcare is fully covered when you need it most. And that's your full comparison of the top Medicare Advantage plans for 2026. If this video helped you understand the differences and updates, please hit the like button, it really supports the channel. Subscribe if you want to stay updated on all Medicare changes, plan comparisons, and cost updates for 2026 and beyond. We'll keep bringing you straightforward explanations so you can make the best decisions for your health and budget. Thanks for watching, and we'll see you in the next video.